This video presentation discusses the structure and importance of vitamin D3, also known as cholecalciferol. It is not to be confused with ergocalciferol, which is actually vitamin D3 and is the plant form of vitamin D. Vitamin D3 is not biologically active until it has been metabolized by the body. It is first synthesized in the skin when ultraviolet light is absorbed by precursor molecule 7-dehydrocholesterol and then gets hydroxylated in the liver by 25-hydroxylase to form calcifidiol. It becomes fully biologically active once hydroxylated further in the kidneys to form 1,25-dihydroxycholecalciferol, or calcitriol. These structures are shown here. Once in this form, vitamin D3 can actually be considered a hormone and is hydrophobic, so must be transported through the blood and carrier proteins. This vitamin is actually one of the few vitamins that is considered non-essential since it is able to be synthesized in the skin when exposed to sunlight. However, sunlight exposure usually does not generate enough vitamin D3 that is recommended daily, which happens to be 15 micrograms for the average adult, and so it still needs to be supplemented dietarily. This can be done through such foods as fish and egg yolks, particularly wild salmon and egg yolks from pasture-raised chickens that get to roam in the sunlight, as they will contain higher levels of vitamin D3. Vitamin D3 has many functions regarding bone health and regulating calcium and phosphorus levels in the blood for metabolic purposes. Calcitriol works to increase the levels of calcium in the blood by promoting absorption of calcium from the intestines. It also increases renal tubular absorption of calcium to help reduce the loss of calcium in the urine. These processes both help to maintain the skeletal calcium balance. Calcitriol also promotes bone resorption by increasing the number of osteoclasts. Bone resorption is the process by which osteoclasts break down tissue in the bones to release minerals, and is important because it transfers calcium from the bone back to the blood when the body has low levels. A deficiency in this vitamin causes impaired bone mineralization, which often leads to softening of the bone. This in turn can lead to osteoporosis and increased risk for fractures. Two diseases that result from the deficiency are rickets and osteomalacia. Rickets is the weakening of bones in children and can be characterized by bowed legs due to weak, deformed long bones. Osteomalacia is the softening of bones in adults and is also seen with bowing of the legs, as well as bending of the spine, proximal muscle weakness, and overall bone fragility. These diseases reduce calcium absorption while increasing calcium loss from the bones. In summary, vitamin D3, or cholecalciferol, is not functional until converted into its bioactive form, calcitriol. It is also non-essential since it can be synthesized in the skin from sunlight. However, it must still be supplemented with such foods as salmon and egg yolks. This vitamin functions as a hormone by signaling the body to uptake calcium from the blood or release it from the bones. A lack of vitamin D3 leads to weak bones, which can cause diseases like osteomalacia and rickets, or simply put one at risk for higher fractures.